and welcome from Geneva headquarters of WHO. You have joined for an embargoed press conference to discuss the findings of our latest World Health Statistics report, the World Health Statistics 2024 report, which is due to be published tomorrow, Friday, at 3 o'clock Geneva time, 1500 Central European Standard Time. That's when also the embargo will lift. Our World Health Statistics report is an annual compilation of health and health-related indicators, and we are publishing this since 2005. My name is Christian Lindmeier, and I'm welcoming you to this press briefing. Let me introduce two speakers now who are available with us today, and I'm very pleased to announce first and foremost Dr. Samira Azma. She's the Assistant Director General for Data Analytics and Delivery for Impact Division here at WHO. Welcome, Samira. Then we have Dr. Haidong Wang. He's the Unit Head for Monitoring, Forecasting and Inequalities, also at Data Analytics and Delivery here at WHO. And last but not least, Dr. Boshen Zhao. He's the statistician at WHO and also at the Data Analytics and Delivery for Impact Division here with us at WHO. Very pleased to have those esteemed colleagues here with me. We'll start with Dr. Azma to give you a bit of a rundown, then we'll have Dr. Haidong Wang go deeper into the report, and last but not least, we're then of course opening for questions. Just one more time to mention, embargo is tomorrow, Friday, at 3 o'clock in the afternoon, Geneva time. Thank you very much, and over to you, Dr. Azma.
Thank you, Christian. A very good morning and a very warm welcome to our friends from the press. Thank you for joining us today. We are pleased to share with you a preview of WHO's flagship publication, the World Health Statistics 2024 report. This is the world's report card on health, and the bottom line is that we are failing. Despite encouraging progress in some countries and for some conditions, overall, life expectancy has fallen, and shockingly, the world is not on track to achieve even single one of 32 health-related sustainable development goals with a global target. The World Health Statistics Report monitors progress towards the health-related SDGs and provides an objective, comprehensive, and comparable assessment of population health and how it is changing. This year's report is particularly important as we reveal the impact of COVID-19. Over a period of just 2 years, that is 2020 and 2021, global life expectancy dropped by 2 years. This wiped out a decade of progress made in improving population health. At the heart of this year's report is our assessment of progress made in achieving health-related SDGs and the triple billion targets. Unfortunately, the world is off track in achieving health-related SDGs. In fact, at the current pace of improvement, not a single one of the health-related SDGs will be achieved by 2030. The world is also off track to achieve the Universal Health Coverage Billion and the Health Emergency Protection Billion by the year 2025. Data, analytics, and delivery are pivotal to help the world get back on track. Timely reporting and accurate estimation of data are key in monitoring progress and critical to deliver measurable impact in countries. This report also highlights health challenges faced by vulnerable groups, people with disabilities, and refugees, migrants. Globally, in 2021, an estimated 1.3 billion people, that is 16% of the world's population, had at least one disability. People living with disability face health inequities due to avoidable, unfair, and unjust factors. Progress requires strengthening health systems and targeted actions to increase equity. Refugees and migrants often experience worst health outcomes in transit and destination countries because of barriers such as language, cultural differences, and institutional discrimination. Lack of quality data further obstructs understanding and addressing their needs and tracking progress on health goals. In school, a failing card or a failing grade may mean the need to repeat a year or a class. Failing our report card means that people who should be alive and healthy are sick or dying. We can't repeat the test. We need to move forward, learn from countries that are making progress, match word of commitment to data and health with funding and specific focused actions, and hold ourselves accountable for getting the world back on track. Now I would like to introduce Dr. Haidong Wang, technical lead of the report, to present key findings. Haidong, you have the floor. Thank you.
Thank you, Samira. Good morning, colleagues, for attending this press conference. So today I will emphasize the key findings from this year's World Health Statistics Report. While significant improvement in population health has been made before the pandemic, the demographic and the epidemiological profiles have been altered during the pandemic years of 2020 and 2021, the last year where we have comprehensive mortality and morbidity estimates for in the World Health Statistics. The results presented here represents great collaborations among technical programs at the WHO and with relevant UN agencies such as UNICEF and the United Nations Population Division. In just 2 years, the COVID-19 pandemic reversed over a decade of gains in both life expectancy at birth and healthy life expectancy, HAIL. By 2020, both global life expectancy and HAIL had rolled back to the 2016 level at 72.5 years and 62.8 years, respectively. The following years saw further declines, with both retreating to the 2012 levels at 71.4 years and 61.9 years for life expectancy and HAIL, respectively. Globally, the share of death from non-communicable disease, or NCDs, among all deaths rose steadily to 74.1% by 2019, while the share of a communicable disease dropped to 18.1%. With the emergence of COVID-19 pandemic, communicable disease surged back to 23% of all deaths in 2020 and 28% in 2021, also a return to the 2012 levels. Consequently, the share of NCD death declined to 70% in 2020 and 65.3% in 2021. COVID-19 ranked among the top 3 leading causes of death globally in 2020 and 2021, responsible for 4.1 million and 8.8 million lives lost, respectively. In the region of the Americas, it was the #1 cause of death in both years and ranked in the top 5 causes for all regions except for the African and West Pacific regions. Now let's talk about the key findings regarding the SDG indicators. While marked reduction in maternal mortality was achieved during the Millennium Development Goal years, globally, the rate of improvement has been slowed and stagnated since the beginning of the SDG era. The number of women dying from a maternal cause has remained unacceptably high. Every 2 minutes, a woman dies from maternal causes, equating 800 deaths every single day. Achieving the SDG target of 70 deaths per 100,000 live births by 2030 will avert over 1 million deaths among women at the global level. Despite the growth in the global population and the number of vehicles, the global number of road traffic fatalities declined by 5.9% from 1.25 million deaths in 2010 to 1.18 million deaths in 2021. However, such progress fell short of achieving the United Nations Decade of Action for Road Safety 2021 to 2030 goals in halving death by 2030. Globally, the premature mortality due to the 4 major non-communicable diseases, cardiovascular disease, cancer, chronic respiratory disease, and diabetes, has seen steady improvement in the last 2 decades, owing largely to the improvement in prevention, diagnosis, and treatment. A 30-year-old person had a 22.7% chance of dying from the 4 major NCDs before reaching the age of 70 in 2000, and this risk has dropped by about 20% points to 18.2% before the onset of the pandemic in 2019. Despite such improvement, the pace of decline has slowed down since the beginning of the SDG era. Major environmental risk factors such as air pollution and unsafe drinking water, sanitation, and hygiene are responsible for millions of deaths globally. In 2019, 6.7 million deaths globally can be attributed to household and ambient air pollution. Our latest estimates for 2019 suggested that 1.4 million deaths globally could have been averted if safe wash are accessible. Among the 1.4 million deaths, 395,000 were among children under the age of 5 years old. Significant progress has been made in achieving the SDG target in ending the epidemics of HIV, TB, malaria, and the neglected tropical diseases, and to combat hepatitis, waterborne disease, and other communicable diseases as well. For example, in 2022, there were 1.3 million new HIV infections, down from 2.8 million in 2000, a reduction of 54%. The global TB incidence rate was 133 per 100,000 in 2022, down from 180 per 100,000 in 2000, a reduction of 26%. However, during the pandemic years of 2021 and 2022, we observed consecutive years of a global increase in TB incidence. In 2022, there were estimated 249 million malaria cases in 85 endemic countries and areas, leading to an estimated 631,000 deaths. In 2022, the malaria incidence rate was 58.4 per 100 population at risk. However, the expected incidence rate needs to be at 26.2 per 1,000 were we to reach the reduction of 90% reduction in malaria incidence by 2030, comparing to the 2015 baseline. The world continues to grapple with the double burden of malnutrition, characterized by the coexistence of undernutrition and overweight and obesity. In 2022, worldwide, over 1 billion people aged 5 years and above were obese, while over 500 million were underweight. In the same year, 148 million children under age 5 were stunned, 45 million were wasted, and 37 overweight. Double-duty actions that efficiently and effectively address both facets of malnutrition are critical to make the most of limited resources. This concludes my presentation. Back to you, Christian. Thank you.
Thank you very much, Dr. Wang and Dr. Asma. Now let me see if we have any questions already up. You present a lot of valuable data here and very interesting and kind of shocking conclusions. While we see, I don't see any hands yet, so please raise your hands with your hands icon in order to get into the queue for questions. Or if no possibility, then you could also write a quick message in the Zoom. We could start with Agence France Presse, with Agnes from AFP. Agnes, please go ahead and unmute.
Yes, hi everybody. Thank you for taking my question. You have talked about lots of statistics, and I would like to ask you an easy question. What is, according to you, the main conclusion, the main statistic of this report that you think is important to know about? Thank you.
Data there. What is the one takeaway, if there is any? What is the one? Is there one cause? Is there one responsible factor? Maybe Dr. Asma.
Thank for your question. It is an important question. If we want to take one message away from this report, is that in just 2 years, global life expectancy dropped by 2 years. That is, we have wiped out a decade of progress. Should I repeat again?
Yes, please.
Okay, sorry, Agnes, we had a bit of a technical glitch. Thank you for your question. If there is one key message we want to take from this report, is that global life expectancy dropped by 2 years in a period of just 2 years. And this means that we have wiped out a decade of progress made in improving population health. This equates to that we really need to rescue what we have lost and to ensure that we maintain a steady environment so that all populations everywhere can thrive.
Thank you very much. No follow-ups. Then we go to Jeremy Lange from RFI. Jeremy, please go ahead and unmute.
Yes, hi. Actually, it's a follow-up on Anya's question. The 2 years you mentioned that we lost it between 2020 and 2021, but can we easily gain those 2 years in the upcoming years, because the pandemic is over? Let's say the virus is still there, but the pandemic is over. So can we easily gain those 2 years back?
Great question again. It is challenging, but we also have tools at our disposal to prevent from further sliding the progress. So for us to keep up with the pace, we really need to redouble our efforts in many of the areas that Haidong presented. The solutions are there. We have all the technical solutions. What we need is also political will so that we can have this sustained progress and catch up with the pace to reach the SDGs by 2030 and the triple billion targets by 2025.
Thank you very much again, Jeremy. Yes, indeed, an important point. We have so many advantages in medical fields. Why do we slide back? Good question. Now we go to Euronews. Lauren Chadwick from Euronews, please go ahead and unmute.
Hi, thank you so much. My question is, it sounds like some of this drop in life expectancy is related to the COVID-19 pandemic. Are countries kind of missing the lessons learned from the pandemic? Have we learned anything from it? That's my first question. And then just my second question, you mentioned environmental factors such as air pollution and safe drinking water. These are factors that could get worse as we see with climate change. What do you think for the future of health indicators, knowing that some of these environmental factors could get worse? Thank you.
And again, Dr. Asma, please.
Thank you very much, Lauren, for the question. The three areas we really need to focus on is to address the root causes of ill health, keeping the population healthy. That means the health promotion policies so that our populations can live healthier as a result of clean water, better food, healthier food options, eliminating the risk factors such as tobacco use, etc. The second is that the populations need to have access to essential health services without incurring financial hardship. And the world is truly off track in meeting the commitment of offering universal health coverage to their populations. We are very far behind. And as was mentioned, medical advances have made that possible. And finally, we really need to keep the world safe. And we can do that by ensuring that we detect outbreaks early, we notify that in a timely manner, and respond to that rapidly before an outbreak becomes an epidemic and even a pandemic. So these three pillars are extremely important, and therefore WHO's strategy is geared around the triple billion targets. And your second question was about, if you can please repeat, risk factors. So maybe I will ask Haidong to share further insights from the data.
Thank you, Samira. I think regarding the questions on air pollution and safe drinking water and how that is going to affect population health in the future, then one thing I want to add to what already mentioned by Dr. Asma is, how fragile the gain in population health is. For example, during the pandemic, how 2 years of life expectancy was wiped out. The progress made essentially lost for a decade. That calls for continued and sustained investment in health that includes improving risk factors such as the environmental risk factors we have discussed today, just for so that if there is a concerted effort between international agencies and the national government to provide and improve any risk factors, including environmental risk factors and behavioral risk factors, that's actually needed to further improve life expectancy and a healthy life expectancy at both the global and the country level. Thank you.
Thank you. Just to remind everybody, because we had a question, the material, the accompanying material, the press release and everything can be received through, well, in this case, easiest through media inquiries, but it was also mentioned in the media advisory that you received for this press briefing today. There's an email address in there where you can get the report and the press release. So please make use of that if you haven't done already. Next question goes to Swiss News Agency, and that's Laurent Sierro, please.
Yeah, thanks, Christian, for taking my question. Another follow-up on the questions about the fall in life expectancy. As we are in the middle of negotiations, which talk a lot about equity, can you make a direct correlation between the extent of the fall of life expectancy in a bunch of countries and the supply of vaccines and medicine during the pandemic? Where was the life expectancy fall greater in countries which were at first less supplies in terms of vaccines against the pandemic? Thank you.
Do we see a direct causal link? Yeah. Do we go to Dr. Wang?
So we haven't done such analysis, but we're working with the MHP division, the Provision Medicine division, to look at the construction of a new index, basically access to essential medicines index. Once the construction of the index is available, we can directly look at outcomes during the pandemic. In addition to life expectancy at birth, we can also look at mortality, excess mortality rate or mortality due to COVID-19 at the country level. And I want to mention that in this year's World Health Statistics report, for the first time, in addition to the assessment of excess mortality, which is the difference between the expected mortality and observed mortality during the pandemic, we also provide a cost disaggregation of mortality as well. Basically, we look at mortality directly can be attributable to COVID-19. So such outcome and access to medicine, we can link that together to look at the impact as well. In addition to that, we can also look at the pandemic preparedness, or IHR, and their relationship with the health outcome, including life expectancy and mortality due to COVID-19. And we can certainly keep keep the press posted on this, and hopefully we can address this in next year's for the health statistics report. Thank you.
Yes, if I may add, Lawrence, to your question and what Haidong outlined, an important aspect for us to close the inequalities is better data, timely, reliable, and actionable data. And we have seen that during the COVID-19 pandemic. Two facts of life, the births and the deaths. We had a huge challenge in truly documenting the true death toll from the pandemic. And that's why we had to use many other statistical approaches to quantify the true impact of the pandemic. We know that 9 out of 10 deaths in Africa are not registered. So when we have this limitation of data inaccessibility, we will not be able to truly quantify accurately nor address and apply the resources where they are needed most. So a call in this report is also for countries and partners to prioritize investment in improving data and health information systems. Not only having data is going to be sufficient, it's about using it in the right manner, at the right place, at the right time, I think is going to be essential. Thank you.
Monitoring the evaluation. Thank you. Laurent, you had a follow-up, if you want to just jump in.
Yeah, thanks for that. So as you're still not able to make that link, maybe can you make a breakdown for us of the regions where the fall of life expectancy was the biggest during these 2 years, and if there was a huge discrepancy between the different regions? Thank you.
See what we have there. To start with Dr. Chow or Dr. Wang?
There is indeed heterogeneity in terms of impact of COVID-19 on life expectancy across countries and regions. As we have mentioned, and also it's in the report, the region of the Americas have seen the biggest impact or negative impact of COVID-19 on life expectancy, and the region of Africa and the West Pacific region actually seen the lowest impact of COVID-19 on life expectancy. And we can certainly provide both the country level and the regional level specific information to you as well after the press conference.
Can journalists disaggregate it from the report directly? Is it?
Yes.
So that's also possible.
Yeah, the report has both country level, regional level, and global level information.
Great, thank you very much. Now we go to Sarah Newell from the FT. Sarah, please go ahead and unmute.
Thanks very much. Do governments around the world grasp the seriousness of the situation, do you think, this loss of life expectancy? And do countries ultimately need to allocate more funding towards health and the social determinants of health?
Yeah, back to the old question, did we learn our lessons here?
Thank you, Sarah. A very important question again. We learn, but I think we forget very fast as well. That's just the nature. But I think we hope that this report truly underscores for the governments that will be meeting next week at the World Health Assembly here in Geneva, that we are going to make a commitment at country level as well as global level that we should not falter again. We cannot be the generation that we don't learn from this lesson that it's a hard lesson that we all have learned, and we owe it to the lives that were lost prematurely in every country we all have experienced. So we hope that as health relates to all of the sustainable development goals, it is not only the responsibility of the ministries of health, it is the responsibility of other allied ministries, heads of states and heads of governments. So the report is a clarion call indeed. Thank you.
Thank you very much. Now, I'm not sure if Agnes from AFP still has a question or not. This was a bit of an up and down. Agnes, anything from you? I guess not. I take silence as an answer here. So,
Yes,
here you
yes,
go.
thank you. Yes, I had some issue. I wanted to have a follow-up at the beginning, but it didn't seem to work. So I wanted to know why it seems so easy for the life expectancy to fall so quickly in a matter of 2 years, but it seems so long and complicated to catch up. Thank you.
Thank you. Took the one.
If I may, so I think Bochen can elaborate on this issue as well. We see life expectancy dropped by 2 years over a 2-year period. That's the result of decline or increase in mortality during the pandemic. On a yearly basis, on average, I think for more recent years, at a global level, we have about 60 million deaths a year. But for the 2 years of 2020 and 2021, we have seen combined excess of almost 15 million deaths. And those 15 million deaths, actual deaths that shouldn't have happened in those 2 years, is going to translate into increase in mortality. And that has a huge impact on the life expectancy itself across the board. Certainly, like I mentioned earlier, the impact of the COVID-19 is not equal among all countries. You have seen countries that is hard hit by the pandemic itself due to population age structure or the epidemiological profile before the pandemic as well. That's the reason why there is a huge impact of COVID-19 on life expectancy itself, and the impact is not equal among countries. Butcher, anything to add?
Yeah, I just want to add that similar to the trend of life expectancy, healthy life expectancy also changed. And that's, healthy life expectancy has two parts. One is increasing mortality causing the decline in healthy life expectancy. The other part is even among the survivors, they are not living as healthy as they should be because of the pandemic. So that's a further contributor to the decline in healthy life expectancy. And the other thing I want to mention is that we've seen many of the the counter-pandemic measures implemented during the pandemic, mask wearing, better sanitation. So these are also factors that would improve population health. And those are things that can be further advanced through better water sanitation and road safety. If those policies continue post the pandemic, I think we can see some further improvement in life expectancy and healthy life expectancy as well. And the other thing is the change in life expectancy is also partly driven by the age pattern of the mortality. So during the pandemic, the elderly are the most vulnerable group that are at greater risk of dying. And among those group, the people who are with preconditions, NCDs, have even higher risk of dying. So these are the messages that we all should take into account in guiding further healthy policy development in the years to come. Thank you.
Thank you very much. I do not see any further questions. It will also take journalists a while to maybe digest all the data information. So let me look into the round and see if any final comments, any closing remarks you want to have. Dr. Asma, maybe?
Thank you very much. I would like to thank all the press for your interest and participating. One important aspect is we can't continue to fly blind. We need better data, better analytics, and better use of data. Data truly tells us where we stand and what stand we need to take. And a remark that was made, and I think political commitment and the investments need to be sustained for population health. Thank you.
Thank you all very much. And again, this was our press conference today on the World Health Statistics 2024. An embargoed press briefing. Embargo is tomorrow, Friday, 24 May at 1500 hours, 3 p.m. afternoon, Geneva times CEST. Thank you very much to Dr. Bo-Shen Zhao, statistician at WHO, Dr. Haidong Wang, the unit head for monitoring for forecasting and inequalities, and Dr. Samira Asma, the assistant director general here at Data Analytics and Delivery for Impact Division, all here at WHO. Thank you all very much and have a good day.